Not make it.
Okay, everybody hang tight. I'll give us the cue. Okay, we're now live.
All right, terrific. Well, welcome everyone to what may be our last campus community advisory meeting of the certainly of the spring semester. And depending on how the chancellor wants to work it, this may be our last formal time together. I don't know. This is a chance to talk about the fall in a more informal way. And so I think the chancellor will kick us off and then we'll have some kind of open conversation about that. Is that your vision?
That works for me. If it works for you and Shana and Reeves. But, well, good. Well, thank you. And it's great to be back with everyone. And again, to Mimi, Reeves, Shana, thanks for your leadership. And I just want to start my remarks off by sort of taking a step back and looking at how far we've come. But certainly we have to be focused on where we're headed. And things have gone really well this semester. I recognize it has not been easy for everyone, but we've now conducted over 150,000 COVID tests through our Carolina Together testing program. The positivity rate in large credit really to our students has remained below 1% the entire semester. And we've had low numbers in our quarantine and isolation residence halls all semester. In fact, at one point, we received notice that there was absolutely nobody living in the quarantine and isolation residence halls, and which was great news. And I think since that point, we've had just maybe a handful at a time at most. But we've not had a cluster notification in over 2 months, and I think since February the 4th. And our frontline workers and essential workers on campus have really worked tirelessly to protect us from the virus. And so, again, I think a large, in large part due to the way in which our students have followed the COVID-19 community standards, and there have been very few violations reported. Chief Perry and his team monitor this, work closely with student affairs, and every Tuesday morning we get an update from our on our COVID calls with our infectious disease, public health experts, and our environmental health and safety team. And some of you that are on this call participate there. But so we're moving quickly to ensure that the community is vaccinated. As of this morning, we had over 2,500 students vaccinated through our on-campus clinic over at the Student Union. And my guess is that by the end of this week, we'll probably be well over 3,000. And the other thing I would just add to that is that we know that we've seen a drop off in the number of students that are signing up for those vaccination slots. And we're hearing that it's not because they don't want to be vaccinated. It's just that many of them actually have gone out and gotten the vaccine, been vaccinated at other places. And so I think this is really good news. And again, I think, how did we accomplish this? Well, I think it's because of everyone came together to solve a problem that we had. And that's kind of our strength here at Carolina. It's the culture of collaboration that I'm so proud of. I asked this group last semester, what would success look like? And I would just say that as I went back and looked at my notes from the answers to that question, we are hitting those benchmarks, and I'm grateful for the hard work of so many, and I'm grateful for the work of this important committee that convened back in mid-September and met on many occasions during the fall semester, and then we've had a few meetings this semester. And so I want to hear from you today. I know this has not been easy, as I've said earlier. I've heard many stories about how people are doing just fine, and they're grateful that they've had the opportunity to access many of the resources here on campus this semester, and they're looking forward to ramping that up. But I've also heard from others that have talked about their personal loss and personal challenges that they've had, and there are a lot of factors that go in to planning for the summer and for the fall. And so, we've experienced some bumps along the way, and we've been able to fix them, I'm proud to say, and our community really came together to resolve them. But I think we can confidently say that the layered approach that we've used has worked. Testing, mask wearing, now the vaccine. And as I've already said, we've kept cases low, and we've limited the spread of the virus and allowed our campus to focus on our mission of teaching, research, and service. And So I think from those successes, we have been able to plan for the fall semester. The roadmap implementation team meets regularly, and they're looking at all the options about how we can, have a successful summer and fall. We are cautiously optimistic, as I continue to say, but as of right now, we're planning for a return to an on-campus working environment for our staff by midsummer. We talked about this at the staff meeting. I think that was earlier this week. At least we will, if we do this by mid-July, that gives us a month out before students begin returning to campus in mid-August for in-person classroom teaching and to really restore the residential campus environment that everybody is craving. And as we've said before, there will likely be several safety measures still in place, but we still have a lot of planning ahead of us. And right now we're sort of in that complicated time on our campus where we can see the light at the end of the tunnel, but we're not yet at the end of the tunnel, but I'm confident that we're going to be able to get there. So we are still operating with some uncertainty with the virus and the variants right now. And I know that it can be challenging for our campus community to try to operate and plan with that uncertainty still there. But I promise that we're going to share information with you as soon as we're able to, and that we'll offer flexibility when possible. But I do want to just say a few more things, and I'm going to open it up. And I want to emphasize that your input today will be important, and your input moving forward will be important. We're looking forward to a spring commencement weekend, and every time I'm out, there are students outside my window getting photographs with their Carolina blue caps and gown on. This is about that time of year as the flowers are coming up. But they are grateful and thanking us for allowing them to celebrate their accomplishments in person in Kenan Stadium. I think that'll happen the weekend of May 14th through the 16th, with 5 ceremonies held beginning Friday afternoon through Sunday afternoon. 2 incredible speakers, Dr. Kizzmekia Corbett, Carolina alum, and one of the lead scientists at the NIH working on the vaccine, alongside Dr. Anthony Fauci, I think who everyone knows. And we're anticipating about 1,000 graduates in the stadium, in Kenan Stadium, for each of those ceremonies. And with up to as many as 4 ticketed guests for each of those graduates. So potentially as many as 4,000 guests in the stadium. And I believe that this is going to work out really well. And I know people are grateful for it. So I think that we're going to emerge stronger from this pandemic. As I have said before, you've heard me use the Wayne Gretzky quote, when he was asked why he was a great hockey player, he said it wasn't because I was necessarily a great shooter or a great skater, but I knew where the puck was going to be, and I got to that spot on the ice. And I think that that's what we need to be doing right now. We need to be thinking about, where is the puck going to be, and to try to plan accordingly. And, how do we respond to the needs of our students? How do we equip our community with the skills that they need? And that includes our faculty and staff. And I think we're going to ensure that we'll have a safe campus community in that environment that so many people are craving for the start of the fall semester. So I want to hear your ideas today as part of this discussion. And I'm going to stop there and turn it back, I think, to Mimi and Shana and Reeves.
Well, let's maybe I'll just throw out a few things that people are asking about, and then as other people formulate their questions. And I did want to, Emily reminded me to tell our folks that are watching via the live stream that they can submit questions to polleverywhere.com, pollev.com, /CCAC0408, or you could text questions to CCAC0408 to 22333. Did I get that right, Emily? Okay, great. So, a lot of people are talking about or asking about the ability to require faculty, students, and staff to be vaccinated before coming back. And it looks like a couple of universities thus far have made that decision, Rutgers and Cornell, and maybe there are others that I'm not up to date. But just wondering where our planning was with that.
Sure.
At the
Yeah, so
moment.
there,
I know that it's emergency use at the moment, but surely that'll change soon. So, recognizing that aspect of the problem.
yes, thanks, Mimi. So there are at least 4 or 5 universities across the country that have mandated that for their students for the return for the fall semester. We're having regular conversations with our own infectious disease public health experts who have said it would be premature, in their opinions, to do that at this point. I believe that's where the system office is on this at this point in time. Right now, we would need a statute, a change in the law here in North Carolina to mandate that. As you know, the CDC has not mandated it either, but we're continuing to monitor this. And as Mike Cohen said, David Weber and others on our call that we had this past Tuesday morning, that we're beginning to see sort of a convergence of data and information that's coming in already, even though the vaccine, as you well know, has only been out for a few months. But we're, as we're seeing North Carolina right now, the data that we received on Tuesday was that around 35% of the state has already received at least, they're partially vaccinated. And I believe it was close to 30% are fully vaccinated. We're going to see that ramping up to where it won't be long before we'll have over half of the state will be vaccinated. And that's the point at which our experts here think that we'll have this convergence of information could help guide decisions that would be made about the potential, requirement of a vaccine for people to return to work or to return to living and learning on campus. And so I don't anticipate that will happen. A decision would be made on that within the next month, but we may reach a point where there's sufficient data that would warrant advocating for that, but we're not at that point right now, according to our experts. And let me just add one more thing. The other point that was brought up is that it's very likely, based on the trends that our experts are tracking, is that we'll be in a place where we're sitting at probably over 80% of our campus community would be vaccinated, at which point, depending who you talk to, most people would say that herd immunity has sort of been established at that point. You combine that with mask wearing and other precautions in place, and there's little risk, as most experts are saying at that point.
Okay. And you had sent out a link in a message maybe 3 or 4 weeks ago where people could register their vaccine if they wanted to. It seems like that would be a really useful thing for people to do. I'm wondering if we can publicize that again. I mean, I've been trying to, I've done that in various forms, and I'm going to do it more, but that might be something to.
Yeah, that's a good point, Mimi. And we'll, Chris, we can, work on a plan with our communications team to do that. What we have been told is that there are far more people vaccinated than what show up in that registry. And so the data are a little misleading. And so how do you interpret what's, the percentage and the numbers that are in that data, in that registry? But we want to try to continue to advocate for people to do that. We can't mandate that they enter their information in the registry, but it certainly is helpful to know, who has.
I see a question from Aaron Nelson. Aaron, do you want to pose your question?
Thanks.
Hi, Aaron.
Happy birthday, Chancellor, and congratulations, President Richards. Do you think the university will require re-entry testing for returning faculty and staff, like they did for students? I think our local public schools did not do re-entry testing for faculty and staff, and may have wished that they did.
Yeah, again, that's another option that's on the table for us. I don't think I know a decision has not been made on that. We have not required that to this point, even for this semester. But as the data emerge and I think if we saw the value in that, that it would be something we'd consider. And Aaron, maybe
Thank
share
you.
a little more. I mean, when you say that they wish they had, I have not seen that or heard that. I'm just curious.
I think over the next week, there'll be more information about positive faculty and staff, and some conversations about who that sends into quarantine if a staff member is positive. You all have more experience with this than the public schools did. But I think there is now some thinking that it would have been an easy thing had they asked, even voluntarily, for all faculty and staff to test prior to returning to the classroom. And I don't think they neither encouraged it nor required it. And it was just a cohort of people who hadn't been to work in a while returning to work.
Okay. Thank you.
Yes, sir, that's cool. You mentioned a little bit about this, and I know there's still a lot up in the air, but I was curious if there's any further information on like what summer classes will look like and what percentage will be in person, and on top of that, like first year orientation and et cetera.
Thanks, Reeves. So right now, the summer school will be predominantly remote. There will be some classes, laboratories, especially. I know that that'll be taught in person, but and I think some hybrid options that'll be there as we move into the second summer session. I don't have the exact numbers and percentage, but it will look a lot like this semester in terms of the vast majority of classes being taught remotely.
Richard, it looks like you have a hand up.
Yes, thank you very much, Mimi, and Chancellor, thank
Hey,
you
Richard.
very much. Hey, how are you doing?
Good.
So just yesterday, it was reported that the UK variant is now the most common strain of, SARS-CoV-2 circulating in the United States. I was just wondering, when you talk to, Mike, and when you talk to David, what are your thoughts regarding continuation of surveillance on campus? Because these variants, are an issue. What are their thoughts about that?
Yeah, well, great question. And they're watching these variants very closely. Fortunately, the good news to this point is that the 3 vaccines that are in use appear to be protecting very effectively against these variants. This is one of the reasons why we are continuing to require testing of our students. We've not adjusted the Carolina Together testing program requirements, despite the fact that probably over the next, another 2 weeks from now, it's likely that the majority of our students will be vaccinated. And so, but we're going to continue to test because there is the possibility that these variants could be detected through that testing, which will help inform our plans for the summer and the fall. And so they are adamant that we continue testing, certainly through commencement, and we'll be making some decisions about what those requirements will be as we move through into summer school and those students having access to campus facilities. Because keep in mind that even if the majority of the classes are being taught remotely, our dining halls are still open, our libraries are open, the student rec centers, et cetera. And I think we will begin to see more people coming to campus. And so we want to be sure that we can protect everyone. And so it's likely that testing program is going to remain in effect for all those reasons.
There's a question coming in through the live stream that as we begin to plan for this fall semester, when do you anticipate providing updated guidance about events and gatherings? Which is a great, people have celebrations to welcome new students,
Yep.
things like that.
Yeah, and I apologize because somebody else, I think in a question, I can't remember who it was, talked about orientation as part of their question. And that's something we're looking closely at as well. We realize that, and let me just say that I've talked to so many students and parents over the past few months, some of whom are saying, don't forget about our sophomores coming back to campus. They did not have a normal first year experience, and they may need to be reoriented to campus, and what are we going to do for them? So I know that our student affairs team and the admissions team is looking closely at how we can do that for orientation. but gosh, Mimi, I'm sorry, I forgot the first part of the question. I jumped to orientation.
It's about gatherings.
Gatherings, thank you.
Gatherings, so, welcome gatherings, or, can you have students over for lunch, or what can you do? Those sorts of things, yeah.
Yes, so I know that the roadmap implementation team is continuing to take requests for these gatherings. I know that they've recently approved, and Chris, I'm going to turn to you to correct me if I'm wrong here, or maybe share a little bit more, but I know that, there's been a lot of questions about summer camps. As you know, our campus is used often for summer camps, not just sports camps, but summer camps in general. And I believe the decision was made to allow day camps with up to certain limits of individuals, but not to allow overnight camps. And I think more guidance is coming on some of these other events that you're describing, Mimi. Chris, can you clarify?
Sure. Well, there'll probably be a communication today or tomorrow. They'll go out and explain some of this. But as Chancellor said, the decision was made to allow for day camps for minors, so under 18. They will be required to show a negative test to participate in those day camps. So that guidance. And then as far as the fall goes, the question that was asked, that's something we are staying in close contact with the Orange County Health Department, North Carolina Department of Health and Human Services. We have, even though the state and the county loosened some of their restrictions in the last couple of weeks, we decided to stay with our current guidelines just through commencement to have some consistency. But we're staying in close contact with those two agencies and plan to comply with all state, federal, local guidelines when it comes to gatherings.
Yeah, and you're right, Chris. That memo, we have finished a campus message that's about to go out. I just couldn't remember if it was going to go out tomorrow or Monday. So it will be out shortly. That provides a lot of this information. And I think we're waiting tomorrow morning at 10 o'clock. We have our Department of Health and Human Services update to be sure that there's no further guidance there, I think, before we hit send on that campus message.
But so in terms of graduation and things like that, it sounds like everything stays the same through graduation. So we should not be planning even small gatherings, in-person gatherings to celebrate small groups of students or things like that.
That's the guidance we've received from our experts here locally. Orange County Health Department really likes our commencement plan for Kenan Stadium. And the volume of people that we're going to have there. They've looked at the way in which we're going to seat people, and the concern was that we're putting all of our efforts there with our staff, our events teams, and then to have other smaller gatherings that typically would happen around departments or schools is just taking a risk that we're just not willing to do at this point.
Okay, Chloe, and then Tom.
Hi, Chancellor Guskiewicz. I just have a comment more because I know you all are thinking about it. I would just like to advocate for some type of hybrid learning in the fall semester in terms of the course instructional modes. We continue to hear from a variety of students and parents who, for whatever reason, will not be able to come back to campus full time in the fall semester on campus. I also know that while the population is small, as of last week, our students who are coming from China, and it could be other countries, the likelihood of them being able to get their visas to be able to enter the country by August is relatively slim to none. And so that population plus the population we admitted last year who have yet to come to campus in terms of international students, I would just, like to publicly advocate that we provide some type of option and flexibility. I don't know what it looks like, and I know that that is a really hard ask for our faculty and instructions in our classrooms to even make sure that we have the technology set up to be able to facilitate that type of learning. However, where we can, it would be greatly beneficial for many of our students.
Chloe, thank you. And we've heard this, I've heard this from a number of our advisory groups, and We will still have our Carolina Away program, which has been very successful over the past 2 semesters. I think maybe as many as 850 students in the fall, and I think we had another 750 or so this semester. So I think that will be an option. And I know we're also looking at options for some hybrid learning environments where we have students in the classroom while they're being we are live streaming to students remotely that need to learn from remotely. So I think there will be options. I will say that we have to keep that in mind while we're also recognizing and planning for as close to a return of the residential learning environment that UNC Chapel Hill is known for, and that's what people are expecting of us, and that's what we're hoping to be able to deliver.
Tom.
Hi, everybody, and hi, Chancellor. I'm going to begin with a quick compliment, which I'm assuming you won't object to, which is just to say that my son, my youngest son, who graduated from UNC last year and obviously missed his graduation, heard about the plans for doing something this year to recognize last year's graduating class, and he thought it was a good idea. And he sent you an email, and he said that within 20 minutes you had responded, and that blows my mind. I don't know if you do that all the time, because he didn't identify himself as my son or anything like that. Anyway,
it was Tom, you should be proud of your son. It was a very thoughtful, well-written message, and I did respond very quickly, and I was proud of him. I happen to know him, as you know, as one of our outstanding alums, both from Chapel Hill High School and from UNC Chapel Hill. So it was great.
Anyway, I was impressed by the 20-minute turnaround. But so the question is kind of related to what Chloe asked. It's only that I'm trying to get a picture of what the fall semester is going to look like. And I think we've said some things that are kind of implying what it's going to look like. And so is it that it's going to be, we hope, that inoculation rates, vaccine rates are going to be high enough that we're pretty much back to business as usual. That is, that we're going to have full capacity in dorms, in classrooms, and so forth. We're not going to be wearing masks. We're not going to be distancing. Is that what we're really shooting for and hoping for and assuming, or not? And because I'm not quite getting that. The answer may be that we still have to wait to hear from our scientists. But kind of what is that picture looking like for the fall?
Sure. So based on the guidance of our experts, they believe we should be and can be preparing for a normal return to the classroom environment with the likelihood of still wearing masks as an extra precaution, knowing that the vast majority of people there will be vaccinated. For residential living, we are preparing to be close to normal capacity. There may be someone else on the call as part of the team here, this committee, that can clarify that from Student Affairs or Chris, maybe from RIT, but I believe that we're still planning to keep at least one residence hall, maybe two, available for isolation and quarantine. But I think we're planning for in the neighborhood of about 7,500 to 8,000 students in our residence halls. Normally would be in the neighborhood of about 9,500. So it's not quite at full capacity, but real close to it. Anybody, can you clarify that? I haven't been in the last 2 RIT meetings.
Chancellor, I think that is correct. That is still our plan. I know Aaron Bockenheimer from Student Affairs is on, but it's the plan still is to have at least 1 or 2 dorms as quarantine isolation dorms, but otherwise be as close to normal as possible.
And Chris, I'm sorry, I just wanted to just clarification. Does that include regular sort of full capacity of classrooms?
Well, that's a separate issue than the dorm capacity. And I know that we're still working on what exactly those classrooms will look like, but, and I'll let the Chancellor answer a little more fully, but as he said, with mask and the inoculation rates as we hope they are, our plan is to try to be as close to as normal capacity in classrooms as well. Chancellor, I'll let you elaborate.
That's correct, Chris. The registrar, and I believe registration goes live, well, June 1st is when students can begin registering. And I believe it's April the 26th or 27th that everything will be uploaded and it'll show the capacity in all those classes. And they are preparing, and the deans have been working hard on this at being at full capacity in those classrooms. Thank you.
We have a live question. And this, I think I'm going to kind of put a little more context around this question. And that is kind of how we all return to work. So the question is, people have been hearing that staff will be required to be 100% remote or 100% in person with limited flexibility allowed for sort of mixing the hybrid or the remote work and the in-person work. I think everyone is wondering, like, what is it that we've learned from this experience in terms of how we can work, and that actually, you know, sometimes there are some benefits from not having to commute for such long times every day, about congestion on campus being lessened by people not having to come in on some sort of set schedule. So I think that, you know, raises this question of how flexible are we going to be with people in the fall, particularly staff that don't have the flexibility that faculty typically would.
Yeah, so let me just jump to the first part of the question, Mimi. We've never, even, you know, throughout this entire pandemic, we've never been 100% remote, and we certainly haven't been 100% in person. It's been a combination, but we are much more in person today for our staff than we were even just 3 months ago. And that's what we expected, was that we would see a gradual return back to normal on-campus operations. As we begin to move, 7,500 students into residence halls, we begin to move 30,000 students back into our classroom environments with full access to libraries and dining halls and everything else that the normal campus operations sort of defines. We will need our staff to be able to help manage that, such that students have those resources available, whether it's, as I look at Shana Hill, who I know has been in her office on many days as a department manager, when a student, comes into the Department of Statistics and Operations Research and they're struggling to find Professor so-and-so, or struggling to, identify how they can get a class changed. It's the staff there that have to be there to help guide and direct. And I'm just using one department of many at the university. So I think that we have to plan to return back to a more normal working environment, in-person working environment. And I realize that there will be some challenges for individuals where accommodations may be necessary, and we're going to lean on supervisors for that. The system office has given autonomy back to the individual campuses to figure out how to best do that, with the expectation, though, that we'll be back into a more normal working environment. So I don't think that it will be 100% in-person working environment, but we anticipate that it will be much closer to that than where we are right now. And supervisors are going to have to play an important role in providing and working around the accommodations that may be necessary. I think, to your point, we have learned a lot about through the pandemic about some of the efficiencies and getting to and from campus, parking, and that there are some roles, some essential job functions that can be carried out perhaps just as efficiently remotely. And I think that we are looking at that. And there will be questions, as you can imagine, though, about equity across individual employees at the on our campus about how to best do that. So we're continuing the conversation.
Okay. Let's see. Donna has a question. Donna, do you want to pose your question?
Sorry, I was just following back up on the mask use in the fall, and I'm just wondering if there'll be any consideration to letting instructors teach masked or maskless by choice.
It's a good question. And, David Weber is our expert on this. And I know that we had these conversations, it seems like it was just yesterday, but it's actually many months ago. And I think that in certain classroom environments, that it very well may be permissible. I don't want to say yes definitively today we can, but I know that David has some opinions on that. Many of our faculty, teach in that classroom. They're already, probably 20, 30 feet away from the students. And I know that many faculty have said that they do want to come back and teach in person, but teaching an hour and 15-minute class fully masked for that with the absence of a few breaks, it may be difficult. And so I think we need to look at that and see if that's not an option.
Other questions, other things people want to bring up? We can go in completely different directions. I know there's a lot of concern certainly within the delegates to the faculty assembly right now about the bill, which is the number I'm going to blank on, but the bill that is giving the system more latitude, it looks like, to implement furloughs in the early retirement system and that sort of thing. Can you speak to that at all? And
that's HB 243.
I knew it was 2-4. I forgot the 3. Okay.
and just to echo, there's great concern among staff as well about that bill.
Yes, thank you. And we did talk a bit about this at the staff advisory committee meeting earlier this week. And I'm really trying to calm people's fears around this. This is actually something that we think is helpful. Becky Mangini, I think if she were here, would say that we've actually have advocated for this. We do not anticipate furloughing many people. We have furloughed very few people here. And as I've said from the beginning, that we're going to protect our mission and our people. And there have been many staff who have asked, and faculty who have asked about the possibility of early retirement options. And so we've been asking through our human resource colleagues on the campuses, working closely with the HR team down at the system office, and to learn what is possible and to get some flexibility around early retirements and different types of furlough options. So again, we do not anticipate that bill, if it's passed, of us going furlough crazy. I promise you, that's not the goal here. It's really to provide some options that many people have been asking about.
Okay. Aaron?
And maybe I should go to this team. I mean, that you're one of our advisory committees here, and very important one. How can we help alleviate those concerns? So if you have ideas, please let me know. I will get with Becky and her team so that we can maybe get some messaging out around this as we continue to watch the progress of that bill as it's working through the General Assembly.
And to me, as I look at it, it sort of falls under the theme of more local control, versus, so in the same way that there are other areas, completely different areas, where this campus has wanted local control, but it also seems like that is something that is, that gets granted to you. That's not necessarily, the bill doesn't give it to you. The bill gives it to the system, and then the system has to give it to you. So right. That's, there are, I don't know what you do about the anxiety around that.
Yeah, I mean, and let me just give you an example. This is just one of, in terms of flexibility that this would potentially provide for us. And it sort of goes back to a question, Mimi, that you or somebody asked earlier, and that is about remote working. We've heard from some individuals who have said, given some of my family constraints and challenges, it's much easier and more efficient for me to work remotely. would I be able to reduce my FTE to 0.8 or 0.75, take a salary reduction, and only work, 4 full days a week, or 30, 32 hours a week. And obviously, some of those essential job functions would have to be shifted to someone else, but that might be more effective and better for an individual to keep them employed at the university, which is important to them and important to the department or the unit. And so this bill would provide some of that flexibility to be able to change somebody, even temporarily, somebody's FTE for a period of time, to afford them some of the ability to take care of challenges at home, and not have to drive 30 minutes to work and deal with parking and pay for parking, and it may help in those. So that's just one example where this could provide some opportunity.
Can I provide some feedback on that? I think for staff, that's completely problematic in that the workload doesn't shift. Just the expectation of hours would shift. The job still needs to get done. And we're already skeletal crews. So I would be very cautious about that, simply because staff are just going to, the expectation is the work still has to be done. And it would just be expected to be done in less time. So I just caution.
Right. And Shane, I want to be clear. I don't see this like wholesale shift of hundreds of people to a 0.8 FTE. There have been some units where they have asked, because they've been asked by employees, if this could be an option. So it certainly would not work for everyone. And I think you're right. It would have to be very clear that certain essential job functions would be shifted away from them toward someone else under that condition.
Aaron, and then Kim.
Thank you. And I wanted to underscore the comments that Tom Kelly put in the chat, thanking you for your leadership during this time. As an outside observer, while you may have felt panic and crisis throughout this, you kept that inside. This process of navigating global pandemic with 30,000 students and 15,000 faculty and staff, or thereabouts, I think is absolutely exceptional. Well-laid plans, trusting on science and feedback and community leaders. And I am grateful that you were our leader at this time. And for the 3 chairs of this committee, I thought this process, the way you engaged community, were all exceptional. So thank you, Chancellor. My question was about infrastructure. If we are returning mostly back to normal in the next semester, and I saw Mary Jane is on this call from the town. I think of the way we got our students, faculty, and staff to campus was in very crowded buses that traveled every 7 minutes with standing room only. If less people are going to be in our transportation infrastructure, we'll be planning strategies for better drop-off systems, for better park and ride, for better, how are we going to get people to and from if we're going to be, I don't imagine they're going to crowd onto a bus in the same way that they might have before. And are there plans that we can begin making to make sure that our commutes and processes of getting people in and off campus are successful?
No, thanks, Aaron. And I'm going to need to turn to Chris on this one, because I've not been in RIT, as I said, the last 2 meetings, but I know that we have a team that spent a lot of time working on this for the fall semester. And we are, our public transportation team is they're looking at options. I just don't know where they are, Chris, on any changes to the current plan.
Yeah, I know that conversations are taking place between our folks and the Chapel Hill Transit folks. And as Aaron said, Mary Jane's on the call and she may be able to add to that. But, as we bring more people back to campus, the transportation has to increase. We've been in a scaled down system. So those conversations of how do we scale back up and what does that look like? Do we need more routes? Do we need less routes to certain places? So they're dependent on us to give them kind of what this campus look like, which is what we're talking about today, and then they can accommodate that.
Chris, in your, or Chancellor, are you estimating that it's about 80% of the faculty and staff that would have been a pre-pandemic peak, or 70% or 100%? Are you have any sort of round numbers that you think about in terms of who makes the daily commute in?
You know, that
I
sounds
don't.
about right, but we haven't talked in those general terms.
If I could chime in, I know that the transit partners are working with obviously the university and others to figure out how to do transit service. There are other federal requirements that they have to follow. And this is the kind of information and conversation that will help shape those plans, understanding what the expectations are on campus, how many, the volume of people will be serving. So I don't think we have definitive plans right now, but I know that those conversations are taking place and it'll evolve over the course of the summer.
Comment on reentry testing, I think, had something to do with that I'll use the public schools, people carpooling with each other who hadn't worked in a year. That is how some of the transmission is happening. And if folks had, pre-tested, they might have had a lot more confidence about using transit or choosing carpool, or encouraging reentry testing might be helpful.
Right. I'm curious, since Aaron's brought this up about reentry testing, and I'd love to hear the group's thoughts on this. I mean, and again, you're representing different constituencies, and wondering how you feel your constituency would feel about required reentry testing to come back in, whether it's mid-July, back to work, back to take a summer class, back, or for mid-August, whenever we're back for that fall semester. Any thoughts? I think we're talking about required reentry is what you're asking about, Aaron.
Required or encouraged, that it being your expectation versus show us your pass.
Okay. Any thoughts?
Well, it's currently not required, testing is not required for staff at this point. So it would be hard to implement for staff. But I will say I had the same response Aaron is expressing when I saw that the public schools were not requiring reentry testing. I thought that was sort of foolhardy.
Yeah. Audrey, as our resident public health expert here, I'm curious if you have any thoughts.
I know people have been texting me about some of these questions, and I know nobody loves the epi answer, which is what you said earlier, Kevin, which is, if everything continues going as it is, and, almost 80% of people are vaccinated and the vaccines work against the variants and infection rates in the community are low, I think we have less to worry about. I think if for some reason vaccine uptake is not as high as we would like, if community prevalence continues, doesn't go down, if the variants prove to be challenging and we see more breakthrough infections in vaccinated people, then, it becomes a harder road to walk. So, I think reentry testing is less, I don't think why it would be different than what we required this semester for the fall, for faculty. And I don't see it being stricter, because we're hoping that things get better. But I guess if things got worse or don't get better, then we would have different thoughts about testing in the fall. So I hate to be like the wait and see, which nobody wants to hear. But I think, as you said, the next 3 months are going to be really critical to understanding what happens in the face of vaccination going up and new variants circulating. I think we're going to learn a lot. So.
Thank you.
Kim, you've been waiting patiently.
Thank you. I just wanted to jump back very quickly to the possibility of flexibility with FTE, and echoing Shayna's concern, of course, right? I think that there could be checkpoints put in that put some measure of control in the employees' hands about whether this happens, so that we don't have a one-sided, oh, we're going to reduce your hours and your salary, but you still have to do the same amount. But I've had the opportunity to work in a North Carolina state agency with that sort of flexibility, and it was really 100% success, and I highly endorse that. It's good. It's a win-win, both in terms of employee retention and morale and really ability to get things done. And from the agency side, financially, there's just nothing magic about 40 hours. So thank you. And happy birthday.
Okay, thanks, Kim.
I think it was Seth and then Jennifer.
Yeah. So my question, and maybe I missed this, was about the Carolina Together testing program. Is that plan to continue in the fall? And, you know, someone posted in the chat that essentially I think there's only evidence that the vaccine, we don't know how long the vaccines provide protection, right? I think there's evidence that they provide protection for maybe 6 months. Hopefully it's a lot longer than that, but we don't know. I do support the reentry testing at this moment, even though we don't know quite what the future holds. But are we still going to have the testing program in the fall? Was sort of my main question.
Sure. Thanks, Seth. Good question. And I think the answer right now to kind of go, I'm going to steal Audrey's line, I think, is that we still have a lot to learn over these next 3 months. But I think the question is, different types of students. Those are going to, everybody will be accessing classrooms. So what does that mean? Right now, that if we kept the same testing program in place, that would mean that we would need to be testing closer to 30,000 students twice a week. And the question is that A, do we have the capacity to do that? B, is it even necessary? So, and then I think that, so I don't imagine that it'll look like it. If that testing program's in place for the fall, I'd be surprised if it looked the same way and had the same requirements that it does today. But if I were a betting man, I would say, yes, we're going to probably have that testing program available. And we're just gonna have to wait to figure out exactly what the requirements would be. And if anybody else wants to jump in and add, because right now it's speculation, I guess.
Yeah. Thank you.
Jennifer.
At the present moment, we still have on the Carolina Together site directives that say that there will be a 6-foot distance on campus, that will be respected. I just wanted to clarify, Chancellor, the classrooms coming back to full capacity, does that mean full capacity with 6 feet between students? Is there any thought, I guess this could be for Audrey, about movement to 3 feet? And then even from an equity standpoint and embracing flexibility, how will that same distance be translated when thinking about staff who work in kind of collective settings, as opposed to being able to go into their office and close the door?
Sure. We are going to provide a safe learning environment, a safe workplace environment based on the guidance of our experts here, as well as that of the other agencies that are out there providing guidance. As I've said, we're planning on a normal classroom environment, which would not allow in some classrooms, in many classrooms, a 6 foot or even probably a 3 feet spacing. What we're being told right now is that it's highly unlikely that would be needed in a herd immunity environment while also wearing masks. And so again, more to come on that, but right now we're planning on normal spacing in the classrooms, and we'll do everything to make people comfortable in the work environment to assure that they're not sitting for hours at a time in close proximity if they're uncomfortable doing that.
Seth, is your hand still up, or is that an artifact? Did you have another question?
Oh, no, I don't.
Okay. Well, we're coming toward the end of our time. Chancellor, I think one question that is on everybody's minds is what happens to this group going forward? I mean, how do you see us interacting? Someone has just posted in the chat from the live stream how much they appreciate these meetings and that they do hope that they continue in some form. So,
well, no, thank you, Mimi. And I want you to know that I can't tell you how much I appreciate and value this input and just the questions. And I've taken notes. I know Chris has taken notes. And anybody else has taken notes, and you want to be sure that note gets, is on our note list, please pass it along. We will, Emily, also have access to the chat, right? And so Emily will be helping with that. I want to spend some time, I think Mimi and Reeves and Shana to get your thoughts about next steps with the groups. I think that's my plan. I realize that some of you have served long beyond what we had asked of you on this committee, but nobody, to my knowledge, has opted out. And so for those of you that saw Coach Williams' press conference last week, he has never liked that opted out. He mentioned that in his press conference. He doesn't like the word opt out. He said, it just means you quit. Nobody has opted out on us. And so I want to, several people here will be potentially changing roles, graduating, moving into new roles. And yes, congratulations to President Richards. I have lost President Richards on my screen. I don't know where he went. Oh no, you're right. You're right in the center of my screen. So I want to get your thoughts, and I'm going to do that here in the next 4 or 5 days to hear your thoughts on how we move forward, and then we'll circle back to the group and potentially invite some additional folks if we're going to move forward. I do have, as I've mentioned a few times here, 5 or 6 groups that I meet with regularly, advisory groups. What I love about this group is it is a broad, a lot of diversity here in terms of the constituencies that you represent, and that makes this feedback really important. So stay tuned. We will get back to you with a game plan.
Okay, all right. Richard, I'm just noticing your hand. Did I miss it before, or?
Oh, no. I just wanted to just throw in just a quick thank you in addition. Chancellor, thanking you and everybody on the committee. But I just wanted to know, and I know you've already done this, but if you could, at least on behalf of me and anybody else who shares in this sentiment, and sharing our thanks and gratitude and appreciation for all the workers of UNC Healthcare. I just received my second dose yesterday, and the people that I interacted with were phenomenal, from the person greeting me there, handing me a mask, to the person sitting there answering my phone and scheduling me. I can't thank them enough. And I just wanted to ask if you would convey our gratitude for their efforts and their hard work and diligence.
Absolutely, we will. And you're right, Richard, I should have acknowledged that in my comments earlier, but they've been incredible. And I'll tell you, in this job that I'm in, I get a lot of feedback, I receive a lot of email, phone calls, and as you can imagine, oftentimes it's not that they're not exchanging pleasantries. And regarding the vaccination program out at the Friday Center and what we did here at the UNC Healthcare, and what we're doing right now with our students over at the Student Union, it's been nothing but positives and thank yous. And I can't take credit for any of that. I just pass it on to Dr. Burks and Ken Pittman and our student affairs team and others that have made that all possible. It's been they've done an incredible job, and I will continue I'll pass it along, your gratitude from this committee as well. So.
Okay, so we'll call it a day for today.
Great.
Thank you, everybody.
Thank you.
Okay, good to see everyone.
Take care, everybody.
Congratulations on graduating to Reeves and to Ryan.
And Ryan, yes, Ryan.
Yeah.